Hi, this video is about the equipment that I use in my Dupuytren's clinic. So I'm going to show you things one by one, we can talk it through. The first thing to show you that you might recognise, these are just normal markers. I use these, they're permanent markers, they come off with alcohol, and I use two colours. I use a black one for my main markup, so I'll mark up the nodules, cords, skin retraction, and also the field. I use a different colour for patients who've got recurrence, if sometimes that happens, so that you can actually notice which are the new nodules. The second thing that I use, if anyone ever has a contracture, then you'd want to measure it. And the way to do that is with this thing, and this is called a finger goniometer. I use a metal one. You can get plastic ones, but I just don't find that they do the job in the way that I need them to. You can see there's a ruler on there, which I find helpful, but most importantly, you can see you can measure angles with it. And so it's a little difficult to demonstrate my own finger, but you can see that if I'm trying to measure an angle like that, then that could give me a readout, and it shows me there what the angle is. The next thing that's important is a ruler, and I use these rulers particularly because actually a lot of rulers don't have zero at the end, and this one does. When I'm looking for loss of hyperextension, so I get them to put their hand on the table, make sure that their knuckle is down here, get them to raise their finger as much as possible, hold it there for a few seconds, and then just measure to the top of the nail, and you can see that that's roughly 4 centimetres. And you can do that for all your fingers, so a ruler definitely is an important thing to have there. The last thing to show you, and this is not necessary, is when you do your markup and looking to do the radiotherapy fields, if you add on a couple of centimetres, that can get you the fields, but I tend to use standard fields. And so, for instance, if a patient had nodules and cords on the 4th ray going up into the ring finger, maybe on the 5th ray and so on, then I could look to get an appropriately sized template that would cover. So if you imagine my hands on the desk, my fingers are together, my thumbs apart, and they're basically as straight as possible. And then I look to fit a template onto that area. Another time we can talk about exactly how to fit that template, but that allows me to have an appropriate field without having to get an electron template made for every single patient. So that's the equipment that I have every day in my Dupuytren's clinic.